the School of Nursing in Nigeria before coming over to this place. We came in here in 2016, and then I got employed here in 2017. It wasn't easy because the international nurses here were few, very, very few. So it makes you feel like you are not part of the system, you know. But when you have other people that you know are from different places and you are together, it builds your confidence.
Good afternoon, everyone. Thank you for joining us. My name is Marwa Hassanin. I'm Assistant Director of Diversity, Equity, and Inclusion.
We have this critical shortage of healthcare workers. Diversifying the workforce is allowing opportunities for people of diverse backgrounds and from abroad to come here. We need them, we need their contributions to fulfill those voids and those areas that otherwise we wouldn't be able to offer.
So the objectives today are to define a bystander. What does bystander mean?
I lead the DEI Council alongside Tim. So we come together and talk about DEI issues and policies and how to really embrace that mission of a culture of caring. We were awarded a $1.7 million grant for 4 years through the Health Resources and Services Administration. This grant is in partnership with the University of Maine Nursing School and Morgan State University. The primary goal is to diversify the nursing workforce, which we really, really need.
The grant also provides funding and scholarships to change our admission criteria to recruit a more diversified student body. And then in partnership with Northern Light Health, we will engage the students early in their academic career through employment to support the healthcare workforce.
Kelly reached out to me this summer saying that I was accepted and was able to benefit from this grant. One of my teachers I have now, she has a Latino background similar to me. Coming here where it is predominantly white, that's something that I did worry about, but coming to the program and seeing that there are people that I can relate to and that I can have even conversations in my native language with is absolutely amazing.
We're partnering with the Northern Light Health's Diversity, Equity, and Inclusion Department to engage our faculty and staff in integrated diversity, equity, and inclusion training alongside the healthcare workforce in the facility.
There's a simulation lab at Eastern Maine Medical Center, and the nursing school at UMaine also has a simulation lab. And so we will be doing DEI scenarios and role play to educate and to bring awareness to these issues.
We believe that this is a more effective training for our faculty because it's specifically applied to the healthcare environment.
And that a lot also help in our patient care because you learn from this, you learn from that, you learn from this culture, you learn from other people, and then you bring them together. You put everything you learn from each other into the care of that patient too.
We wouldn't have been able to pull something off this big, of this magnitude, had it not been for this collaborative effort.
Throughout any big initiative, we cannot do without our partners. So our partners in this grant, Northern Light Health and Morgan State University, are critical to the success of our project in diversifying our student body and with the ultimate goal of diversifying the workforce.
Being able to accept diversity into our nursing program and leading that to having diverse nurses in the future is an amazing part of this program, and I'm very glad that I can be a step in that as well.
We have so many supportive people here in Eastern Maine Medical, I tell you. For me, most especially, to be able to survive here, we have a lot of support which we're forever grateful for.